Welcome to the Mobile Community Health Clinic. We have an electronic health record system that is easy to learn. It is designed to help you quickly and accurately document patient information. As you can see on the left side of each screen is a handy navigation pane that displays a menu of choices that will allow the user to quickly access the patient information. I will go through 3 patients with you just to show you what our system offers. Our first patient is Mr. McCants. As you can see, Mr. McCants has all his personal information listed in a secure network. Here we see that Mr. McCants has Blue Cross and Blue Shield. He's also a smoker. Our records indicate that on September the 11th, he came in complaining of having numbness on one side, which he was later diagnosed with having a stroke. Have had a stroke. We have here on the right side of our screen prescription information. He was offered or prescribed Tylenol along with Flexeril medication. We have a choice of once we enter Mr. McCant's information, our system gives us an alert to let us know what medications that he can or what labs that he needs. Because he's a smoker, our screen alerted us that he needs to have smoking cessation counseling. Because of his age of 65 and older, he qualifies for the pneumonia vaccination. And because he has a stroke or have had a history of a stroke, he has to have anticoagulation education, which requires all patients who are on blood thinners. Mr. McCants also have an option that if whenever he may need to have information about his visits, we can run him a report. We can run a visit report. All we do is enter in his dates. Since I don't know what all dates he was here, I would just put in a range of dates. Great. We showed that he was here on August the 26th and on September the 11th, complaining of stroke, back pain, and gout. We also have an option to show all medications that has been prescribed for Mr. McCants. He's had Tylenol and Flexeril. We show that this medication was sent to CVS and Walmart. He has refills and the date the prescriptions were written. If Mr. McCants had needed a summary of his visit, then we also can offer that. Again, we would enter in his start date. Since I don't know what the dates are, I will just put in a random number. That was there we go. We showed that Mr. McCants came in on August the 26th, and he complained that he had fell off of a ladder. An MRI was ordered, and he also received Tylenol on that day. This system is easy to use, and it also gives great information. Also, we can give our patient information that they can take home and be able to learn more about their diagnosis. Here we see that Mr. McCants, who was diagnosed with a previous stroke, can have all this pregnant information. Let's move to our next patient. Our next patient is Ms. Lyndall Daniels. Ms. Daniels came in on June 3rd complaining of loss of rapid weight, vision problems, and nausea. Our clinician diagnosed her as diabetes. We see that she's also a smoker. We better check our alerts to make sure before we prescribe any medication. Our alert says that she qualifies for smoking cessation counseling and also for diabetic consult. We notice that she is not 65 and older, so she did not qualify for the pneumonia vaccination. And 2, we will give Ms. McCants patient education so that she will learn about how to take care of herself. This is an easy tool that we love to give our patients so that they will be able to live a healthy lifestyle. Ms. Daniels, also was prescribed metformin as one of her medications. Let's look at our third patient. Our third patient is Mr. Johnny Yeagert. Mr. Yeagert, a male, Blue Cross Blue Shield insurance. He's a smoker, and he has been diagnosed with kidney disease. Our information sheet says that we are to follow, that this is a follow-up patient to continue on dialysis as ordered, and his labs are normal today. We can give Mr. Yeagert patient information, education report, which shows that he has kidney disease. Also, patients with kidney disease qualifies for different types of medications because of their symptoms and their disease. So let's click his alert. He's prescribed smoking cessation, and there's an alert that says that this is a renal patient, so we must check our labs before prescribing. Again, we can also run a prescription report to show all medications that Mr. Yeager has received. We can run a visit report to show the dates that he has come in. There, we see that he's been treated for kidney disease, and he also has a history of asthma. And on our summary report, we can see that these are the things that happened at the time of his visit. This system is designed to meet the needs of our community. We want to make sure that this is a system that is friendly and easy to use. I hope that you've enjoyed the presentation. If you have any questions, please feel free to contact Mobile Community Health Clinic. Thank you.